Suicide is a prominent public health concern, and over the last 5 years, from 2011 to 2015, the average number per year is 2,687. It's an alarming statistic, and we're going out to the streets of Perth today to find out what people think about that and, in their opinion or views, what needs to happen to reduce that number.
I could name probably 6 people offhand, just like that I know that have committed suicide, and that's too many. That's just too scary.
I know lots of people that have tried to commit suicide and have been there. I've been there a bit too lately as well. So yeah, it's pretty intense.
Obviously there's a lot of different things out there nowadays that affect young kids, probably more than so when I was a bit younger, but yeah, I don't think it's good, and I think a lot more should be done about it, yeah.
There's a lot of the time it's a lot of family issues. Households in Australia are pretty messed up. There's a lot of drug issues and alcohol issues here. And especially alcoholism is like a massive part of it.
I think it's more like social media. It's so big and people just live in social media and not in real life. So they compare themselves with upper states that are not realistic. I think there's the struggle, I think, and I think schools could do stuff with that, yeah.
Could it be more about education for the younger people or for the public?
It's hard to say. Like, we got taught about it in schools and it's still being on the news and everything, but it's not stopping it from happening.
What sort of programs or education could be provided to sort this out?
I guess starting it through primary school and the bullying programs and stuff. But I also think that more educational programs for the teachers and staff and mental health practitioners and doctors, because they don't really understand a lot.
The focus seems to be a certain amount on younger generation, but there is actually an older generation both in the city and also in the country, with some farmers under pressure. Also a returning military, which they don't seem to be being looked after.
A lot of teens and a lot of adults and a lot of Aboriginal people are taking their lives, and it's quite sad to know that this stuff is happening and the government's not really doing anything about it, because they need to start bringing in cyber care and more programs for people to help them.
I worked in mental health for many years, so I've seen from before when there was catchment areas, there was beds, there was places to go, and now you can be suicidal or actively suicidal, they'll turn you away at the door.
I reckon there needs to be a bit more help with the suicide, and maybe like better call lines and stuff like that. Because right now with having to call someone is quite a big effort, so I feel like maybe there was like a text-able thing or something like that, you know. Someone there.
And what do you think would save someone's life if they were in that depressed state?
Honestly, I'm not too sure, because when someone gets in that state, it's pretty hard to get them out of it. It takes a lot of work. Yeah, I don't know. I think it's just kind of having to help them and just be there by their side the entire time. You need to be able to communicate with someone. There has to be always someone there to talk to.
Check on your friends. Check on your friends. Talk to people. Talk to your family. Talk. Lines of communication have to be open, don't they? As soon as the lines shut down.
Just 5 minutes, an hour, just talk to someone.
Let them know you're there.
Let them know how you feel.
Yeah.